I suppose, describe the typical patient or even the range of patients
Yeah.
that you usually meet in your clinics who you can help?
So a typical range would be BMI. I say most patients are BMI 35 to 45. That's the majority of patients, certainly in the clinics and when I'm at Eterno. That's the range of patients I would expect most of the group to come in with. And they're very typically patients who tried lots of different things for weight loss.
Can I just ask? So
yes.
Someone below a BMI of 35 is probably not suitable for this?
Well, it depends. So we start to get into it's a bit more of a difficult decision for surgery. There are other things we can do for BMIs below 35. So so with surgery, there's a definitive operation. So I'll talk about gastric bypass and gastric sleeve being the main two. And then there's things like gastric balloons or endoscopic procedures, which have the slightly lower BMI, so 27 to 35. So if we, to try and keep things busy, if we stick to those definitive operations of sort of 35 and above, that's for surgery. The groups below, it tends to be the same thing. There's patients whose weight has done this. They've gone through cycles of Slimming World, Weight Watchers, and it's very hard to keep your weight down. And you get it down, fine. Keep it down is a much more difficult situation. So most patients have been, for a number of years, having their weight going up and down. And actually a lot of patients who come to clinic, they've been thinking about some form of weight loss surgery, often for a number of years, and not sure whether to go ahead with it. So yeah, typically, often patients are anywhere between about we operate from 18 upwards essentially, but most patients would fall around sort of 30s, 40s, 50s. I say most patients would come into that. Right. So yeah, that's the sort of group I'd normally see.